Welcome everybody, April 15th. It is tax day. Make sure you get everything postmarked before the end of the day today. Maybe Yvette was right. I'm not funny, Paul. I won't try to be funny. So we have the work that we've done in this short session is in front of us. There's a lot that's missing and there's a lot that isn't missing, but that's why this committee exists. So our plan today, members, is to have Liam and Kyle take us through the A1, which is a combination of everything. And then Friday, we will do markups. So whatever is forgotten or missed, Friday we'll do it. Senator Utke, I know there's a couple of provisions that we need to include in here. We will take care of that on Friday. You just make sure we get the language to whoever on this committee, right? And so we'll make sure that that gets taken care of Friday. And then anything else, Senator Aaron McQuaid, I think we're good to go. So Mr. Monahan, Mr. Raymond, the table is yours.
Thank you, Mr. Chair and members. I'm Kyle Raymond, fiscal analyst to this committee. So today I'll be walking through the spreadsheet that reflects the DE to SF 4476, the A1. I'll start off by just pointing out the timestamp in the bottom right-hand corner, April 15th at 2:50 p.m. There was an earlier version that was posted that contained 1:50 p.m., excuse me. There was an earlier version that was posted this morning that contained a formula error on line 186. When I get to that, I'll identify the change again, but that was the only change between the two documents. So to start, on the first half of the first page just contains summary information. Lines 6 through 8 show the general fund base for this committee, and then how those are changed via both the governor's budget in the center set of columns and the DE on the right-hand set of columns. Moving next to line 11, this shows the total effect of the bill for all agencies and all funds. You can see for fiscal year 26-27, the DE reduces general fund appropriations by just over 55 million in the 26-27 biennium, and then in the tails increases general fund spending by 184.2 million. The next section contains an agency breakdown, all of which are general fund only. I will also note there are a couple of changes to special revenue funds that don't have, they either net to zero or they're transfers, so they don't affect the appropriation level and are not represented up here. Before going into the proposals, I'll just note as I go through, I'll skip over any the governor's recommendations that are not included, and then I'll also mention that to the extent possible, we've aligned the order of the proposals with the bill index, which is also in the members' materials and available publicly. So next I will move to the specific proposals included, starting with the Department of Human Services, line 146. This proposal establishes a continuity of care team and has a cost associated with it of just over 4.5 million in the 26-27 biennium and about 11.4 million in the tails. Moving next to line 155, this is from Senate File 3848 and modifies inflation protection under the long-term care partnership policy. This has a cost of $313,000 in the 26-27 biennium and just over 1.25 million in the 28-29 biennium. Moving next to line 159. So this is a governor's proposal, and there was also a Senate File 4728 that included a similar proposal, the modified nursing facility level of care eligibility for CADI and BI. So this reduces expected future expenditures by about 2.6 million in the 26-27 biennium, and then about 42.7 million in the 28-29 biennium. Moving now to page 2. The next proposal included is in the DE is on line 169. This is a governor's recommendation to include DHS in their state medical review team and medical records in the medical records fee waiver statute. Moving next to line 171, this is from SF4, modified version of SF 4279. This is related to enhanced home and community-based setting co-location prohibitions, also known as congregate care. I'll note that this also has an MDH amount included later on, which I'll touch on, but the DHS portion is just under 1.2 million in the 26-27 biennium, and then just under 2.2 million in the 28-29 biennium. Moving next to line 181, SF 3898. So this is a proposal that requires interpretive guidelines for disability waiver regulations. This has a cost of $300,000 in the 26-27 biennium and just over $700,000 in the 28-29 biennium. Moving next to line 186, this is a proposal related to a governor's recommendation related to transforming the human services system. So I'll note here that this is one of the crossover proposals. I think the governor's proposal was listed in Senator Wickland, the HHS jurisdiction, but there were components under this committee's jurisdiction. So the what is included on line 186 is the Min Choices Assessment Team Work Group and Study, and this is funded at the governor's level of just over 2.8 million in the 26-27 biennium and just over 13 million in the tails. I will note this is the item that there was an error with compared to the prior version. So the actual numbers are just the 2.5 million and the 13.1 in the tails. Moving next to line 205, this is a modified version of Senate File 4512, which repeals Waiver Reimagine. This has a cost of just over 2 million in the 26-27 biennium and just over 50.5 million in the tails. Now moving to page 3, line 211. So this is a reduction to the assumed spending reductions from future cost saving proposals with the contingent reduction. So this was enacted in 2025. The total net reductions for the long-term services and supports assumed savings was roughly about 177 million. So this essentially would buy back about 112.128 million of that amount. Moving next to line 216, this is from Senate File 4395. It includes a waiver case management work group and rate study. The cost of this proposal is 374 million in the 26-27 biennium and 510,000 in the 28-29 biennium. Moving next to line 222, this is another of the cross-jurisdictional proposals related to transforming the human services system. This is a governor's recommendation, and this proposal would fund an assessment of roles in administering human services programs. This would have a cost of just under 2.5 million in the current biennium and just over 1 million in the 28-29 biennium. Moving next to line 250, this is a governor's proposal related to the Medicaid access rule and federal compliance with it. This has a cost of 1.4 million in the first biennium and just under 2.3 million at the tails, so it's included at the governor's level in the DE. So next, there are quite a few proposals that are not included. The next proposal that is included is on page 8. Page 8, line 417, this is a governor's proposal. They had a number of technical changes that are broken apart in the spreadsheet. So this first one is a transition direct payment of state tribal prevention funds change, which is included and is a no-cost proposal. Line 419, this is another technical change of a governor recommendation, and the proposal directs payments for tribal allocation payment changes. This is also included in the DE. Moving next to line 421, this is a governor's proposal that moves forward something this committee enacted last year, which is it moves up the effective date for improving supportive housing options. This reduces future expected expenditures by just over 9.1 million in the 26-27 biennium and roughly 1.8 million in the 28-29 biennium. Moving next to line 426, this is another governor's technical recommendation that makes a change to the SUD modeled rates statutes, and that is included. Moving next to line 428, this is another technical change that expands the eligible uses of withdrawal management and startup and capacity building grants. That is included as well. Moving next to line 433, this is a governor's recommendation related to access to services for incarcerated individuals and relating to federal compliance. This proposal is included at the governor's level of 178,000 in the 26-27 biennium and just over 3 million in the tails. This was another, this proposal was listed under the HHS spreadsheet, but was included in this bill. Moving next to line 443, this is another governor's proposal with a technical change to allow carryover of gambling treatment provider rollover funding. This proposal is included in the DE. Moving next to line 445, this relates to Senate File 2972 related to for-profit acquisitions of nonprofit long-term care facilities as well as staffing requirements. This proposal has cost to 3 agencies, so this is just the DHS portion, and this is included at a cost of 100,000 in the 26-27 biennium and just over 700,000 in the tails. Moving next to page 9, the next proposal included is on line 452. This is from Senate File 3844 relating to long-term care facility cost increase reviews and as well as regulatory changes. Again, this one has a cost to DHS and MDH. This is the DHS portion only, and it is has a cost of 304,000 in the 28-29 biennium only. Moving next to line 457, this is a governor's proposal to provide additional funding for the Human Services Response Contingency Account. This is included at the governor's amount of 10 million in the 26-27 biennium and is one time. Moving next to line 463, this is a governor's proposal related to a number of reducing a number of human services grants. I'll note one of those is reducing the long-term services and supports loan program. It would reduce the balance and then also put in place provisions to wind down the program. In addition, there are I believe 4 other grants that are reduced in this proposal. The net effect of all of those changes is a reduction of expenditures of about 73.8 million in the 26-27 biennium and about 5.8 million in the 28-29 biennium. Lastly, for DHS, on line 474, the governor's proposal with technical changes related to extending the pediatric home to hospital pilot, which was also a Senate File 3967, is included in the DE. So moving to direct care and treatment, there are 3 proposals that are included. They were all the governor's proposals for direct care and treatment, starting on line 571, providing authority to accept gifts for patients is included. Line 583 exempts DCT from security X-ray machine requirements. That's another budget neutral proposal that is included. And then on line 585, would extend the county correctional facility pilot program, and that is a no-cost proposal as well. So moving to page 10, now moving to the Department of Health, line 621. This is a governor's proposal to extend the HCBS Employee Scholarship and Loan Forgiveness Fund appropriations that is included in the DE. Moving next to line 623. This is, as I mentioned earlier, SF 2972. This is the MDH portion of that proposal relating to for-profit acquisitions of nonprofit long-term care facilities and staffing requirements. This would have a cost of $475,000 in the first biennium and about $27 million in the 28-29 biennium. Moving next to line 627. This relates to Senate File 3733. Home care licensing surveys and investigating fine modifications, and that is included in the DE. Moving next to line 629, SF 3844, which I talked about earlier in the DHS section, related to long-term care facility cost increase review, and also regulation. The administrative costs to effectuate the proposal cost just under $2.6 million in the 26-27 biennium and $5 million in the 28-29 biennium. Moving next to line 633, this relates to Senate File, a modified version of Senate File 4279, congregate care modifications. This has a cost of $1.661 million in the 26-27 biennium and just over $3 million in the 28-29 biennium. Moving next to line 637, this is Senate File, a part of Senate File 4121. I believe the other, there was one part of the bill that made modifications to fines. This is a state government special revenue fine for MDH and is statutorily appropriated, and it would be expected to net to zero. So the other parts of the bill are included in the policy bill. This is retained in the budget bill. Moving next to line 639, this is a proposal to fund a small assisted living facility licensure group. This is $150,000 in the 26-27 biennium one time. Moving next to line 643, this is a governor's proposal to make a correction, the substance use disorder administrative language, and this is included in the DE. Finally, there is an appropriation for the Attorney General's office related to Senate File 2972, related to for-profit acquisitions of nonprofit long-term care facilities, specifically nursing facilities and assisted living facilities. And this would have a cost of $112,000 in the 26-27 biennium and would have a tails cost of $224,000. Mr. Chair, that concludes my remarks.
Thank you, Senator Rasmussen.
Thank you, Mr. Chair, and appreciate all the hard work from nonpartisan staff on putting together the summary of the index and walking through the bill today. Mr. Chair, I was wondering could you help set the table a little bit for how the Senate is going to handle the human services budget conversation this year? And mainly, we don't have targets. I haven't seen any information on how the Finance Committee will view a budget proposal from this committee. I was wondering if you could just offer some insight on do we have a target? Do we have a list of pre-approved items, or is it really in the purview of this committee to decide what the human services budget should be?
Well, let's unravel that one. There's lots of questions in that one. I can answer the question on the target. There was no discussion of targets. There was conversation about what priorities are, right? And then that's been to the extent of that, right? There was allocation conversations, and so that is fitted. I wasn't going to bring this up, but I'm gonna. I was said there was 184, but if you really look at it, minus 55, you only net 130. So there's not a fair and balanced approach right now that I'm looking at it. I think that begs us to really have a deeper conversation on Friday. This is good that Mr. Raymond put us through this. So the answer is no target conversation. It's caucus priorities. We're still it's going to end up happening is we're going to do what we need to do here. Send it to finance. Are there members or anybody on finance on this committee? Are you still? No. Glenn? No. Zainab? Oh, Zainab. Okay, so we have one person on finance on this committee. So whatever we decide to talk about or do on Friday, we're going to go in front of finance and have to. This is our committee's priorities is what I guess. Senator Rasmussen, does that not answer your question? Answers your question? Sort of?
Thank you, Mr. Chair. I appreciate, some of the information there, and, we'll continue conversation ahead of Friday.
Awesome. We're going to go to Senator Abler, then Senator Gruenhagen.
Well, thank you, Mr. Chair. And actually, in this morning in the other Human Services Committee, they had $750 million that they spent there. So we are obviously the frugal, thoughtful committee, but, and so for their caucus priorities, and I don't fault any of those priorities. I think that the nice thing about this committee is your caucus's priorities are our caucus's priorities. And it's about the people and serving well. And I think it's about, nothing against the other committee. It's fine, all the stuff they do. But I think we can be kind of a bright light shining in this really foggy world that we're in at this point in the session, to make sure people understand that human beings are important. And it doesn't matter anything about what kind of human being they are, but we're committed to that. And I also want to thank you very much for having blank pages after blank pages from the chief executive's list of his priorities, which we thought were really not well done. So, and I want to thank again Ms. Bailey, who's still here.
She came back.
Yeah, I want to thank her for returning. I hope you got a few hours just to recuperate, but no, and we were being nice. So maybe if you want to have the chief executive come and he can explain how these are going to make the system better by cutting nursing homes by hundreds of millions of dollars. But anyway, thank you, Mr. Chair. I appreciate that.
And to those points we were talking about is there was the discussion, we have some we have neutral budget items that we're going to carry both here, and instead of it going over to finance, we're actually going to secede to the other body, because they are carrying that in our Human Services Committee work. So Gruenhagen, or do you want to follow up to that, Jordan? You want to go Senator Gruenhagen?
Okay.
Yeah.
Well, thank you, Mr. Chair. Yeah, I just got a few questions. What are the number of new FTEs in this bill? And where are they located? Or aren't there any?
Glenn, you want to point out what's your line? Give me the first line that you're looking at.
Well, we're spending some additional money here.
Yep.
And I'm just wondering, is that buying employees, full-time employees?
You talking about, do you start on line 173 on the Office of Inspector General, that one?
Yeah.
The answer is yes, that we are paying for new Inspector General people within that. That is correct.
Do we have a total, what this bill will do or not?
I don't know the total. I don't know if Christy Grom or Miss Bailey have a total on that one either. I do know it was budgeted. Mr. Raymond.
Mr. Chair, Senator Gruenhagen, so I don't have a cumulative total. I could put that together. So if you look at the spreadsheet, it does list where there are FTEs,
Yep.
and then by year there's an annual amount. So typically the governor's budget does include like a cumulative total, but as we're putting the both governor's proposals together as well as proposals that we received from fiscal notes, those are kind of, there's a lot of last minute changes that are occurring, so I don't have a cumulative total, but I could get one to you.
Well, and the reason I'm asking, it'd be interesting what the cumulative total is and where they're going to land.
Yeah.
Are they local helping, or are they up here at the state, or whatever? Because, when I was on the school board, as chief negotiator, that's.
You were on the school board?
Yeah.
Was he, what school board? Did you guys know that?
What?
Is that news to you?
Anyway, that was
Glencoe,
one
I
thing
bet,
that
wasn't it?
always negotiated was full-time employees, because we want them in the most effective places as possible.
Yeah.
So I'd appreciate that information if they get that together by Friday. The next thing I'd say is, what really concerns me, and I got some compliments in here too, I'll save those for Friday though. I'm bringing up the concerns this time.
You're good.
Is the moratorium on assisted living and nursing homes, new nursing homes. I know that's not in here, but the thing is, I don't like the moratorium in general, because what happens is you think you're going to reduce costs, but when you reduce supply, especially when we're in a demographic situation where the baby boomers are moving into their senior years, you think you're gonna reduce your cost. In effect, you actually increase your cost because you create shortages. Therefore, I would really like to see some flexibility on assisted living and nursing homes instead, in terms of new ones.
Did we, no, I hear you on that, because that's exactly what you end up happening, is there's a capacity issue, right? And you
Yeah.
end up moving nursing home. I don't know if we have.
I maybe should have addressed it earlier, but it just occurred to me as I was looking at this.
No, you're fine. I mean, there's still time to do that. You know, there's a Steely Dan song going to be on the floor, I think, called A19 amendment. Glenn, maybe you look at seeing if we add it in there, you know, if there's some discussion, I don't know.
You know, I know moratoriums are sometimes popular. They think, well, we're going to cap our cost. But it really is like putting a lid on a boiling pot of water. You're not turning the burner down. And excess supply and competition always creates lower cost.
Yeah, no,
And
can
it
you
was
look?
just a thought.
No, it's a great thought. Look in our policy stuff. If there's something that needs to be added to as we move this thing.
Okay.
If something's missing, Glenn, or Senator Gruenhagen, absolutely, let's bring it. I don't know. I think it would be wise for us to bring it to the floor on a policy
Okay.
conversation is what be my.
Well, I'm throwing it out for food for thought.
Well, it's
Okay,
good.
maybe we could address it on the
I think
floor.
it's good food for thought. In your FTE conversation, I think I agree with you. I'd like to see where all those 50-50, 4-9 and whatever going. So Senator Rasmussen.
No, wait, I had more.
Oh, you did? Oh, I thought you said you were done. Sorry.
No, I got a whole list of grievances.
Oh, wait,
No, I'm
there's
just
more.
kidding.
What's that? Isn't there a
You're not in it,
commercial?
though.
Oh, wait, there's more.
I don't like the ratio that's in this bill for nursing homes. I mean, we're micromanaging from the state down, and you're usurping local control. And you're gonna drive up cost with that ratio. In fact, you might actually have empty beds because they can't meet the ratio with qualified people. I did have a conversation with
Toby?
the nursing home people, and they did not care for that. They said, this is an unworkable mandate. Now, the other thing I became aware of, I don't believe the House bill has it in it, this ratio thing. And again, I've known, I've had customers in my insurance agency in nursing homes. I've known nursing home staff. I don't know one of them that doesn't want to do a bad job with the residents.
He's looking at Article 4.
Yeah.
Sections 2 to 6, 25 and 34. And that's where I think Mr. Monahan will probably be going over some of these discussions too. There's a letter I think Toby Pearson was going to send to people. Is that what you're talking about?
Yeah.
Okay. All right. Okay. We're on that.
So I just don't care for that provision. I think it's going to be unworkable and expensive at a time where nursing homes are short finances and staff in many cases, and they need some flexibility. So I don't know to what degree we can build flexibility in for the care of the patients. I don't want any patient to get hurt either. But on the other hand, I don't want to micromanage from the state down.
I think that's the same. Yeah, no, Fateh, yeah, it's
Okay,
absolutely the
I'm
same.
almost done.
No, you're good. We're just having crosstalk about that, Glenn, because these are issues that this committee talks about, so you're good.
Well, you might check with the House, are they even going to accept something like that? You know what I mean? If they're not, then it's kind of an exercise in futility. I got others, but the last thing I just say, and this is outside the purview of our committee, you know, with this demographic change that we have, we're headed towards a crisis. I sell long-term care insurance in my insurance agency, and you hear over and over and over again about the baby boomers, you know, retiring and not enough young people behind them. So, and I think this would be in commerce, but we really need to look at some tax credits or deductions, and we've got some, to incentivize people buying their own long-term care insurance and getting off the state providing all this. So that isn't in our purview, I don't think. I think it's in a Commerce Department. But I've been doing this since 1978, okay? And, you know, I'm probably not the smartest person in the world, but I can see a crisis coming.
Yeah.
And you look at the number of people I got on Medicare supplements in my agency, between myself and a couple other agents, and you see the fewer young people behind, and you see them going into their senior years where they're gonna need assisted living or long-term care. And if they think the state's gonna cough up all the money to pay for that, I mean, they got another guest coming, but anyway. just
Senator
my-
Fatah says Senator Gruenhagen's point.
I was going to suggest Senator Gruenhagen have more babies. I think that would
There you
solve the
go.
issue.
We could stop abortion would help, by the way.
See,
Just a
thank you,
thought.
Fatah, for doing that. Senator Rasmussen,
He
bring us
brought it up, not me.
I know. He gave you the alley-oop, he said it, of course. Senator Rasmussen.
Thank you, Mr. Chair. One other question I have is, do you expect us to have a standalone human services budget bill on the Senate floor, or would you anticipate this budget work being combined with additional budget bills, and if so, which budget bills? I'm just wanting to understand how you think we'll see this work show up on the Senate floor. Thank you, Mr. Chair.
Here's what I do know. We are going to have a by itself policy bill, and we are going to have a by itself integrity bill, which but we're working in collaboration with Senator Wickland. All that stuff is going to get molded, right? Then we're going to make it all fit, right? The budget, my understanding of the budget process, supplemental budget process, right? Supplemental, this is not is that it's one big supplemental budget bill. So it'll be mixed in with whoever else. Like we're gonna be competing against higher education, for crying out loud, right? I mean, that's what we're doing. Just like what the Senator Abler said this morning, that was 775 million or something, or 750 million to that one. So that is my understanding, is it's all into one big, that's why we're sending everything to Senator Marty, and then we'll work from there.
Thank you, Mr. Chair. So to make sure I understand, so the Wickland's health budget bill, the program integrity bill, and then our human services bill, they all go to finance, and then you'd anticipate that those bills, in addition to other budget bills, would be combined in the finance committee and sent to the floor, or
No,
make sure I understand.
Yeah, no, thank you for that. I'm glad you asked, because sometimes I don't know if I'm being clear. The integrity bill is going to be by itself. So that's the work we did by getting Wickland and Abler, and we're all, right? So there's that. The policy bill is by itself. So all the work on the policy stuff. Now, third bill, the finance bill, that's all going to go to one big budget bill that's Senator Marty in finance. That's why I asked, who do we have that's in finance on this committee? We have one person, which is good, because then we'll have that conversation with her. So, oh God, why did you say that? Where's Glenn when you need him? Can we move on to Mr. Monahan? You're good? Lead Rasmussen, we're good? Senator Aaron McQuaid? Senator Utke, you're good down there? Mr. Monahan, take us home.
Mr. Chair, members, I'm going to walk through the A1 bill index. Much of what I'm going to say is perhaps going to be repetitive of what Mr. Raymond has already covered. Where there are changes from the language as this committee saw it earlier, I'll try to give a brief explanation of what some of the changes are. So Article 1 is the continuity of care, or a portion of the continuity of care proposal that is actually currently in the policy bill. But the language presented here takes a slightly different approach with respect to the cost associated with those provisions. So these were modified to not assume that the Department of Human Services would absorb the costs of implementing these proposals. So that's why they're being carried here. I'll also mention that some of the language was modified to make it a bit clearer exactly what role the counties would have in funding portions of the work that the Department of Human Services would assume upon a county's failure to provide adequate alternative services to an individual who loses services as the result of a withhold from the commissioner. So just to remind you of the overall proposal, Section 1 of Article 1 establishes a continuity of care team at the Department of Human Services to pre-plan, coordinate, and oversee the continuity of care of all clients of a residential waiver service provider who is subject to a payment withhold initiated by the commissioner, and provides for direct intervention by the continuity of care team if the lead agency is unable to establish adequate continuity of care. And Section 2 of Article 1 makes 2 changes to the statutes governing payment withholds. The first clarifies what is existing law, that the commissioner has the authority to stop a payment withhold under federally defined good cause exemptions, and 2, requires the commissioner to coordinate with the department's continuity of care team before implementing a payment withhold, so that the continuity of care team has sufficient time to pre-plan for any disruption in residential waiver services that may result from the payment withhold. Article 2 is the Aging and Disability Services article. Sections 1 and 13 are the changes to the long-term care insurance product known as the Long-Term Care Partnership Policy. This is from Senator Kupek's Senate File 3484 that was heard in this committee. There are some technical changes included in Section 13. Sections 2, 3, 15, and 25 are the governor's proposal to modify the nursing facility level of care for CADI and BI waiver eligibility. This is similar to a proposal that was floating around last year during conference committee. Section 4 is a governor's proposal that originated in Senator Wickland's Senate File 5048. This is exempting exempting requests for medical records from the medical records fee requirements, or permissions, I suppose, when the records are being requested for the purposes of a medical review team disability determination. I will point out, perhaps for the agency's benefit, that I rewrote this language to be, in my opinion, clearer. Sections 5, 6, 7, and 8 are a modified version of Senate File 4279. This is the language associated with the co-location prohibitions that the committee heard about from the mayors of the Northwest Mayors Group. This is modified from the original version. It's also modified from the version that was briefly in Senate File 476. It's also a modified version of an amendment that Senator Hoffman offered and then withdrew during markup of that bill. The primary difference from the amendment that was offered but then withdrawn is that it provides a more I guess a clear definition of what adjoining properties are. and specifies that easements or right-of-ways that occur between otherwise adjoining properties doesn't change the fact that they're going to be considered adjoining for the purposes of the co-location prohibition. Beginning with section 9, our group of sections from the governor's proposal related to the long-term services and support loan program. It reduces the loan program by freezing future loans, winding down the program as loans are repaid, and then repealing the program in its entirety once the last repayments are made. Also note that in the repealer, there's a repeal of the HCBS Innovation Grants Program. Section 12 is from Senate File 3898, Senator Utke's bill requiring interpretive guidelines for disability waiver regulations. Section 14 and 24 are another governor's proposal establishing a statewide team of certified min-choice assessor, and Section 24 requires the commissioner to convene a min-choices redesign working group. Sections 16, 17, 18, 19, and paragraphs B and C in the repealer are the complete repeal of Waiver Reimagine. Section 20 is a new proposal which reduces the assumed savings attributable to the work of the Long-Term Services and Support Advisory Council, I think by 112 million or so. Section 23 is the governor's proposal which has to do with getting the department and the counties and tribes together to reassess their various administrative roles within the human services system. Moving on to Article 3, these are behavioral health provisions. These are all governor's proposals. Most of them are technical in nature. That's denoted by the OP-46 code. The two substantive proposals, one begins with Section 3. This is moving up the effective date for improving supportive housing options by, I believe it's 6 months. And the other group of new proposals, which are part of federal conformity with a waiver program, I believe, creates access for services for incarcerated individuals. Moving to Article 4, Section 1 is a Department of Health proposal related to extending available funds for the HCBS loan forgiveness program. Sections 2 to 6, 25, and 34 are the staffing ratios for nursing homes. From Senator Dibble's bill, 2972, the third engrossment. Beginning with Section 7 are provisions from Senator Mann's Senate File 3844 related to automatic external defibrillators and various training requirements associated with their use in nursing homes and assisted living facilities. Section 8 and 33 are from Senator Wickland's 3733, authorizing the use of fines collected related to home care licensing surveys and investigations. Section 9 is also from that same Senator Wickland bill. This modifies the procedures for filling vacancies on the Home Care and Assisted Living Advisory Council. Sections 10, 13, and 16 are from Senator Mann's 3844. This is the language related to the Commissioner of Health's obligation to approve or disapprove proposals to increase the amount charged to residents of assisted living facilities. Sections 11, 12, 14, and 20 are from Senator Hoffman's 4279. This is the other half of the co-location prohibition language. In this case, it's a prohibition that applies to certain small assisted living facilities. Next is Senator Abler's Senate File 4121. This is a series of statutory changes related to training and responses when residents of assisted living facilities have a medical emergency. Sections 26 to 31 are from Senator Dibble's Senate File 2972, related to the regulation and notice requirements when a for-profit purchases a nonprofit nursing home or assisted living facility. And finally, for this article, Section 32 is a new proposal requiring the Commissioner of Health to develop recommendations for an alternative licensing category for small assisted living facilities. And Article 5 is the entirety of Senate File 5029, the direct care and treatment policy recommendations from the governor. The first bit is about giving the executive board authority to accept gifts from patients. And the second proposal has to do with how security screening systems at secure facilities are treated from a regulatory perspective. That concludes the articles I'm going to cover.
Thank you, Mr. Monahan. Members, any questions for our esteemed Mr. Monahan? Lead Rasmussen.
Thank you, Mr. Chair. I have a fairly technical question. If you look at page 33, line 21. Page 33, line 21.
Yep.
I'm just wondering, there's a clause 9, I think, includes high-intensity residential services, and I just wanted to know, is that intentionally not included for cost reasons, or is there some policy reason that we just went up to clause 9 and not clause 10? Just wanted to see if that was in original language or not.
Let me see who's Senator, Mr. Monahan.
Mr. Chair, Senator Rasmussen, that question is under consideration. It's unclear what the answer is.
Do you think, Mr. Monahan, would that something that you think we could get an answer by Friday on?
Mr. Chair, almost certainly. I just don't want to speculate on what the reason is, but if it needs to be fixed, it can be fixed on Friday.
Okay. Jordan, you good with that? If it needs to be, okay. Anybody else for Mr. Monahan? Senator Abler.
I just want to thank him for his work. If you notice the timestamp, it's copies are still pretty warm, and I have a feeling, knowing that that's the timestamp, that maybe it took some, little bit of work, just early into the evening and maybe later. So, Mr. Chair, if we're ever going to have a scorecard for like the most amazing staff, Mr. Chair, we win. And I do have another question.
And, you know, to that point, I think you're spot on. I'll never forget, as a freshman, coming to a committee hearing and hearing a conversation about cans of corn. And and it's rolled into many conversations, but it absolutely made sense for me that your kitchen cupboard, you want to line up your statutes so that they're all making sense, and that's where Mr. Monahan has always been about. And in the other body, you know, Joe Schumacher brought me 2 cans of corn and said I should put those in my hot dish. Can you believe that? Senator Abler.
Mr. Chair, they do raise corn out there. Anyway, so maybe it's a question for fiscal or even maybe the department. So in these fiscal notes that are in here, do we have to pay for staff we know they're not going to be able to hire?
Mr. Raymond, you want to attempt that, or is Elise Bailey running around here?
Mr. Chair, Senator Abler, so fiscal notes are advisory. The department puts forward their work and what they expect in terms of FTEs, given the changes and modifications that are included in the language. The legislature has authority to provide administrative funding. Yes.
Mr. Chair.
Senator.
It was a little rhetorical, but I appreciate it. But so there is a real question. I remember back when we were in leaner times, Senator Benson would inquire about how many positions are unfilled and where does that money go? And so, Mr. Chair, maybe a question you as a chair want to ask is, so we've paid for all these positions. There may be positions that we paid for under my gavel that are still unfilled. So we have 3 years of money that just sits in a box somewhere. Is there like a big coffee fund?
Here she comes. You did it. You baited to get the smartest person in the state of Minnesota who's going to look at you and say, you're going to have to pay for that 3 times, right?
And so, Mr. Chair, before she comes, I would suggest we could take that money and increase the wages of all the current staff to show our appreciation for their work.
And you're not being facetious. You're actually being real on this, and I agree with you,
Yeah,
because there was a question we brought up of what's the holdup for why people aren't getting hired after we gave to Glenn, to Senator Gruenhagen's point, we gave money to fulfill positions, and then I had found out that the commissioner really has no control over the HR functions within the Department of Human Services. That's wrong. If anybody wants to do an amendment, I think we should write one up that says to give that commissioner full authority over who is hired or not hired within the, at least that function, right?
Mr. Chair, I wouldn't give the commissioner the power. We'll just tell them to give them like 5% more as a one-time thing or something, or pay for a Bahamas trip for the team.
No, Jim, don't even go there. This is, it's like, that's funny. Miss Bailey, that's an age-old question that the good senator from Anoka has been asking since he was in the other chamber and he was chair of that certain commission over there. So it's all yours.
Yeah, Chair Hoffman, Senator Abler. I was going to have an answer, but now that you brought up Bahamas, it may change. Yeah, so as you know, probably, we get appropriated on a biennial basis, and so we don't get to hold that money. If we don't get to hire, it goes back to the bottom line. I would say right now where we are in the fiscal year and the pressures on the agency, we are having to take on staff from all over the enterprise, redeployed staff, to do the work of the program integrity work under the corrective action plan. So we're having to pay for other staff all these expenses that we normally wouldn't incur to go out and revalidate, for example, 3,000 or whoever new provider sites or ongoing provider sites. So we have an exceptional amount of pressures that we're having to basically redirect funding towards to comply with what the federal government is requiring of us. Beyond that, I mean, we always have vacancies. It takes a long time to hire folks. It's a long process, and we would love to work with the legislature on issues around classification. If that's a long-term project, but that is a challenge for us to be able to get through the process.
Senator Abler, and then to that point, Senator Rasmussen wanted to jump in on that point too.
Well,
So you want to go,
I'll
Jordan?
finish in a second.
All
So
right.
Senator Hoffman, so I don't know what we spend every budget bill. If we spend $1 billion, if 50 million goes to staff or something. But Senator Hoffman, when that money drops to the bottom line,
It goes to the bottom line.
it goes to the bottom line. And where did that money come from, Mr. Chair?
That would come right
Came
here.
from our target.
Yes, our
So we
target.
could not help some senior person have like special services. We could not help people have, something that could be done. And so, Mr. Chair, that money goes to build roads and pay for whatever.
I know.
Just I thought that'd help you out.
And this committee, it was Senator Aaron McQuaid who reminded people that $1.825 billion of a certain, was underspent money. I mean, when something falls to the bottom line, it doesn't go to help our most vulnerable. It goes off into someplace else, so.
Mr. Chair, we could actually put language in saying that money would go to staff as kind of a lottery bonus. At the end on June 30th, I think Mr. Nauman would get a kick out of that. So
Well, it would not
we could
be
say a percentage goes just to people for their wonderful and our own staff as well, Mr. Chair.
So, you're on something. Senator Rasmussen.
Thank you, Mr. Chair. And I don't know if this question is, who this is best directed towards, and maybe you, Mr. Chair, or Senator Wickland or Ms. Bailey. Earlier on this session, we were presented with a number of forecast adjustments within the human services space that affect the budget for this area. And so my question, Mr. Chair, is do we know what bill those forecast adjustments will potentially be carried in? Will that be in this bill? Will that show up somewhere else? I don't know if Ms. Bailey has information or how we typically address those.
That's a great question. Let's ask people who
And
know.
the reason I asked, Mr. Chair, is that there's a lot of meaningful forecast adjustments because of delays with waivers and different programs being ended. We had, for example, savings from program integrity initiatives, and just want to understand exactly where that will show up.
Which I hope you're leading us to the point of last year, we had marked $178 million. Are we going to get credit for that too? Add that to that same conversation. Where does that show up, Kyle? Mr. Raymond, do you know? Can you answer that? Is that anybody on this can?
Mr. Chair, Senator Rasmussen, all I can really say is that it's not included in the appropriations article in this bill, and like that historically has been the case for the human services portion of the forecast article, dating at least back until 2023. It has been in the health and human services bill. As to what bill it will be included in going forward, I can't speak to that.
Okay. Senator Fata, to that point.
Mr. Chair, I
Rasmussen,
think,
follow up,
could I ask Senator Wickland if she maybe has some information or
It
context?
looks like it's Senator Wickland.
Thank you.
Mr. Chair and Senator Rasmussen, yesterday in Finance, they passed a bill that they merged several of the forecast adjustment bills into one, and I think that's what's carrying it, but I don't remember which exact one is it was the Human Services one. There were multiple forecast adjustment bills that were in my committee, and we passed them out to Finance. And then yesterday, they were putting several together in one bill so that they could be carried together.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Senator Wickland. That answers my question. The only thing I just wanted to flag for the committee is I think fundamentally we don't pay enough attention to these forecast adjustments because they are effectively an appropriation from the legislature. But I worry that we just basically take what MMB produces for us in terms of forecast adjustments and give it too much of a rubber stamp as it goes through this process. And especially within this committee's jurisdiction, because we had certain programs that were in last year's budget that were delayed in being implemented, both things that saved money and things that cost money, there's actually quite a bit of changes. And I think, for example, before we have a bill on the Senate floor that makes these forecast adjustments, which are effectively an appropriation, it's changing the budget. It's effectively a mini supplemental budget. I would like this committee to go through what those changes are within our budget jurisdiction, to understand what savings are being claimed and what costs are being realized within our committee jurisdiction. So I would have preferred, Mr. Chair, and apologies for not catching or flagging this earlier, but even having that bill in this committee if we were going to be having these forecast adjustments come out.
Especially if they were related specifically to the services that we are
Yes.
taking care of in here, and that was not.
Yes, Mr. Chair, it sounds like that what has been the practice the last few years has been that has gone in the health, that the health committee has had a bill related to that as well.
Correct,
It sounds
but
like.
no, I'm with you on that. But because we sat here again 3 years ago and we talked about the 1.825 billion, and we did our little forecast grab, and we did our thing, but it didn't equate to now. I like where you're going with this, because now you're saying, I want to know exactly what was affected by this and why we were not included. Am I getting it right?
Yes, Mr. Chair, and I think, and being able to go through those forecast adjustments in that bill would allow us to know what the net impact is for our budget area. Is this forecast adjustments net spending money in human services? Is it net saving money in human services? When we had the Department of Human Services walk through some of those anticipated forecast adjustments, that was helpful information, but would like to know kind of what that bill ultimately looks like.
I think Eric Nauman is listening to this conversation, and I think it would be good to maybe have Kyle Raymond, is that fair to ask Mr. Raymond to follow up? Those are some pretty good questions as far as the jurisdictional side of that. Can we ask? Yeah. And by Friday we can make adjustments Friday. I expect Friday to be very robust. It sounds like there's it's good to see the squirrel cages moving again in this committee. So Senator Fata, as a follow-up, we forgot about you in the conversation.
It's all good. So just, and I was just chatting on the side with Senator Abler. So just to be clear, when we legislate like X amount of dollars for folks to be hired, and it's not done within a specific amount of time, then that money is lost or goes back to the bottom line. Is that how it works?
Yeah, I think that's Senator Rasmussen. That's exactly where the conversation is. Where is that going?
Yes.
What happened? It goes to where we were all having this conversation 3 years ago, right?
Yeah. So then, what's that?
Oh, sorry, Kyle, Mr. Raymond.
Mr. Chair, Senator Fate, so that generally is correct, because the base funding for the central office of DHS is under the Health and Human Services bill. I'm not entirely sure. There was some, perhaps Ms. Bailey could speak to that, but I know that there was some carry forward authority giving, so that would be the only caveat, but otherwise it cancels to the fund from which it originated.
You know what? That I completely spaced that piece of it, that the administrative functions fall under the senator with the health people at the end of that. You got Utke and Wickland over there. I mean, it's Senator Wickland's. That's correct. Ms. Bailey, you should know never to walk away from the table, because someone's going to ask a question. That's good. Anyway.
Yeah, Chair Hoffman, Senator Fate, to clarify, when I was speaking about funds falling to the bottom line, it's really the period of time where we haven't hired folks initially, right? Because there's a hiring delay. But if you appropriate base funding for us to hire an ongoing FTE, eventually we're hiring them, right? So it's that period of time. Usually in our fiscal notes, we assume a hiring delay of like 3-4 months. But sometimes it takes much longer than that. And so that amount of funding is what typically falls to the bottom line if it isn't spent.
That's Senator Fata.
So then would it be helpful to maybe amend to say that the money can be retained for that purpose? Or, I don't know.
I would say yes, but that would be considered Senator Abler, I think you've done that.
I just want the money back, Mr. Chair. I mean, You ought to try to do a budget in a deficit time and cut 1.8635 billion
Yeah.
and then realize that they're going to keep, that just because stuff happens, they're going to keep $20 million or something. And it's not because
She's
of the
shaking her
person at
head
the
yes.
table
Yeah.
that this happens, but it's like, it's
Well,
pretty
Senator
horrible.
Abler,
Thank
you could set up a special revenue fund that,
Oh, I knew that was coming. Yeah, that her special revenue fund that we took away from last year, so, yes, we did. All right.
That was kind of unkind, Mr. Chair. Why would you do that?
Oh, God. Was that unkind?
Chair
I think
Hoffman, you're
the
never
other
on
body
time.
did it. The other body did it. It wasn't us in the Senate. It was the other body.
Yeah, I don't remember.
Either do I. I don't know. I think we got a lot of work in front of us between now and Friday. Members, right? Is everybody on? Let's do this. Senator Utke, I already asked you at the very beginning, so we're good there. So with all that, we will see you Friday at what time, Sam? 11 a.m. Thank you, everybody. Thank you. Thank you. I appreciate you. We are adjourned.